The Democratic Republic of the Congo is still battling with its latest round of Ebola. In response, China has dispatched an anti-epidemic medical expert team to support local containment efforts and help strengthen the country's long-term disease control capacity. This is China-Africa Talk. I'm Gao Junya. The 5 medical experts are on a 3-month mission that combines emergency humanitarian assistance with public health capacity building. To learn more about their work and the latest developments in the outbreak, I caught up with Chinese ambassador to the DRC, Zhao. According to Ambassador Zhao, since arriving in the country, the medical team has worked with local health authorities and institutions. They're helping to develop a system to strengthen local response capacity and improving preparedness for future outbreaks.
此次援安刚果金抗疫医疗专家组由国内多个部门分别选派。
The Chinese anti-epidemic medical expert team consists of specialists covering the fields of epidemiology, clinical treatment, virology, and traditional Chinese medicine. The 5 experts have participated in global health assistance missions and Ebola response efforts on multiple occasions. Upon arrival in the DRC, it established close coordination with the DRC Ministry of Health, local medical institutions, Chinese enterprises, Chinese community organizations, and international organizations such as the World Health Organization and the International Committee of the Red Cross. The team has also held a series of meetings with the Chinese medical team in the DRC to analyze the outbreak and produce assessment reports.
目前，专家组正同刚果金的同事一道。
Currently, Chinese experts are working with their Congolese counterparts to establish a comprehensive system covering triage, screening, treatment, and infection prevention and control, with the aim of creating a model for Ebola cases management and helping improve the country's epidemic response capacity.
Ambassador Zhao points out the current mission reflects a broader approach that China has taken towards health cooperation with Africa.
中国同非洲国家的卫生合作，切合驻在国实际。
China's health cooperation with African countries is based on local realities, respects the needs of partner countries, and emphasizes practical, sustainable results. China has been sending medical teams to the DRC for more than 50 years and has helped build 2 general hospitals in the country. China has also repeatedly provided emergency humanitarian assistance when needed. These measures, combining immediate support with long-term capacity building, have been widely welcomed by all sectors of Congolese society. Within the scope of its capabilities, China will continue to support the DRC in improving healthcare conditions and strengthening its public health system.
The Congolese side has welcomed China's assistance, saying the move comes at a critical moment.
刚方对此深表感谢，高度赞赏中方义举。
The Congolese side has expressed sincere appreciation and highly commended China's timely support, while positively evaluating China's long-standing contributions to the country's healthcare sector. At the airport welcoming ceremony, representatives of the DRC Ministry of Health described the arrival of the Chinese medical experts as timely and strong support for the Congolese government and people. During meetings with the expert team, the Secretary General of the Ministry of Health recalled the deep friendship and solidarity between the peoples of the 2 countries.
在埃博拉疫情防控的关键阶段。
At this critical stage of Ebola prevention and control, the cooperation represents not only a vivid example of the comprehensive strategic cooperative partnership between China and the DRC, but also a concrete action by China in advancing the building of an all-weather China-Africa community with a shared future for the new era and the global community of health for all.
The Democratic Republic of the Congo is no stranger to Ebola. Since the virus was first identified in 1976, the country has experienced repeated outbreaks. And the current epidemic is the latest challenge facing a nation already struggling with armed conflicts, displacement, and limited healthcare resources. Although the outbreak remains geographically contained, Ambassador Zhao warns against complacency.
绝大多数集中在东部的伊图里省，其余的病例来自北基伍和南基伍省。
The vast majority of cases are concentrated in the eastern province of Ituri, while the remaining cases have been reported in North Kivu and South Kivu provinces. Since the outbreak began, China's Ministry of Foreign Affairs and the Chinese Embassy in the DRC have issued multiple consular advisories urging Chinese citizens to strengthen preventive measures and providing guidance on Ebola prevention and response. Although the outbreak has not spread beyond the 3 affected provinces, and its impact on Chinese enterprises and communities in the DRC remains limited, vigilance must not be relaxed. Continued preventive efforts are essential.
Ambassador Zhao says the challenges extend beyond public health, and he asked Chinese to stay away from high-risk areas.
刚果金东部、伊图里、北基伍、南基伍等省份安全形势十分严峻。
The security situation in eastern provinces such as Ituri, North Kivu, and South Kivu remains extremely serious. Fighting continues between government forces and the M23 rebel group, while various illegal armed groups remain active. Elsewhere in the country, social problems and criminal incidents occur frequently. Combined with the Ebola outbreak, these factors create a high-risk environment for Chinese citizens. The Chinese embassy therefore advises Chinese citizens to avoid non-essential travel to the DRC and strongly urges them not to travel to high-risk areas, including Ituri, North Kivu, South Kivu, and Ebola provinces. Chinese nationals and enterprises already in the country should closely monitor local security developments, strengthen risk awareness, strictly comply with epidemic prevention requirements, carefully plan travel and business activities, and be prepared to respond to emergencies in order to safeguard their personal and property safety.
妥善应对突发情况，切实保障人身和财产安全。
Health workers and medical experts in the DRC are determined to save lives and strengthen the country's ability to confront the next public health emergency. China-Africa Talk will continue following the work of the Chinese medical expert team and bring you updates from the ground. That's it for this edition of our program. You can find us on major podcast platforms and on Substack. Just search China-Africa Talk. I'm Gao Junya. Bye for now.